The edge is intended to align and introduce interventional devices. It consists of 2 clips on either end of the device to secure the edge to a surgical towel and 6 elastomeric friction-fit slits designed to hold and organize guide wires and catheters. The slits are organized into pairs of 2, so each pair can accommodate a catheter and its corresponding guide wire. Each pair is labeled main vessel, branch 1, or branch 2. Each of the slits is identical and can accommodate either a guide wire or a catheter. The edge can lie nicely on a flat surface, but it also has a curved bottom to allow it to fit snugly onto a patient's leg, about 20 centimeters, or 2 edge lengths from a Y connector. To use the edge, simply place the device about 2 lengths from a Y adapter. Use the integrated clips on either end to secure it to a surgical towel. Just pull up on the towel and it will slide right inside the clip. Simply press the lever and disengage the towel and reposition it. Then take a guide wire and place it into one of the slits. In this case, we choose the slit labeled main vessel and place the wire all the way down to the bottom of the slit. The guide wire will be held securely, yet it can be removed easily without bending the wire. The guide wire slit is designed to hold the wire with optimum tension, to prevent guide wire movement but still allow the wire to be removed with one hand or 2 hands without bending the wire. After the guide wire is secure, simply slide a catheter over the guide wire into the vessel. While it is not necessary to hold the guide wire, to be safe, use fluoroscopy to ensure the wire is stable. When the catheter is in position, place it in the adjoining slit and push it about halfway down to obtain optimal tension. The slit widens at its base, so the further down you push the catheter, resistance to catheter movement is created. Pushing the catheter about halfway down the slit holds the catheter in place without bending it. If you push the catheter all the way down, it will be held very tightly, but you can still remove it with one hand or 2 hands. The edge is helpful for treating branch or bifurcation lesions because one can place a second guide wire into the slit corresponding to branch 1, press it all the way down, then press a second device into the adjoining slit and press it about halfway down to get the desired amount of tension. Now we have very neatly organized wires and catheters for treating a bifurcation lesion. And one can place another wire and catheter in the branch number 2 slits or 2 more wires as needed. Each slit has identical dimensions and works equally well for wires or catheters. To precisely position balloon and stent catheters, one simply removes the catheter from the slit and makes the needed micro adjustments. This minimizes catheter interaction and catheter or wire wrapping. Tips and tricks. Find a comfortable place to secure the edge. Usually this will be about 2 edge lengths from the Y adapter, but some will like it closer and some further. If the edge is too far from the Y adapter, then catheter shafts may not reach the friction slits. If the edge interferes with hand movements, offset it a few centimeters away from the physician, to the side. Always remember to replace catheter shafts into the respective friction slits after making micro adjustments. This will help keep the field neat and minimize catheter wrapping. The edge will neatly organize guide wires and catheters, minimize guide wire and catheter wrapping, minimize guide wire loss, enhance guide wire and catheter stability, and simplify the procedure.